Good morning. It is Monday, August 16th. Welcome into the Morning Medical Update. The burden on area hospitals with the current surge in COVID cases has gotten progressively worse. The presidents of the Kansas and Missouri Hospital Associations are here to help us share details, along with our Chief Medical Officer, of course, Dr. Steve Stites, and our Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson. So here are key points you need to know that we will be discussing today. You will not get into a metro hospital by transfer. Why? Patient volume is at an all-time high across our hospitals due to COVID-19 and demand by other sick patients. The number of COVID patients needing hospitalization is growing and filling up beds needed by people with other illnesses. Staff is tired. People have forgotten that it's COVID. Healthcare workers are stressed. They are tired and worn out, and we simply need the public's help. Before we get to those points, we're going to check in with Dr. Hawkinson for our COVID count. Good morning to you. And I was going to ask you how the numbers are the last couple of days.
Yeah.
Not good.
No, the numbers have gone up quite a bit since last week. Right now, we are sitting on 63 active patients with 21 in the ICU and 16 on the ventilator. We still have 22 additional patients in that recovery period, so 85 patients total. We haven't had this number of active infections in the hospital since January, so the numbers have gone up quite significantly. Hays has 8 active patients and 1 in recovery, and they had a death in the last 24 hours. Our last death was on the 13th of August.
All right, thanks for that update. I'm going to introduce our guest here in just a moment. Dr. Stites, just want to give you a moment to give us some words.
To complain? I'm going
to complain. I'll let you go for it.
Here it goes. Hey, we're really full, and everybody's full in Kansas City. You heard that Hays is at 8 patients today. We think that this whole thing is moving west. You know, a couple weeks ago, Wichita wasn't as bad. We know from Friday's Chief Medical Officer call in Wichita, things are difficult in Wichita as well. We know from our CMO call on Friday, things are very difficult. We hope to have a couple of those this week. A couple of things. First, we got calls from Mississippi, Georgia, Arkansas, Louisiana, Texas, New Mexico, Oklahoma about taking patients. But we can't take anybody. Our transfer center's up. Transfer center requests are up by about 3 to 4 times normal, and we're only being able to accept 10%, maybe at best, of those transfers. Over the weekend, there was a 25-year-old who had delivered a child and had COVID-19, needed ECMO for heart-lung support, and we couldn't find a bed. And we tried hard. We just couldn't find a bed. And we couldn't find staff to take care of that patient in that bed. So, you know, we're all struggling right now. Beyond that, I would point out to you all that there was a patient in Salina, Kansas, we couldn't find a bed for in Kansas. That patient ended up in, I think, Oshkosh, Wisconsin. So, you know, we are this is bad. Tim Williamson, our VP of Quality and Safety, talked about how he remembered a time when it's like standing in the Flint Hills and watching one of those ground fires start to burn, the wind come up, and the fire's coming at you, and you can't get away from it. That's where we are, and we need everyone's help. I visited with Lee Norman over the weekend and said, man, you know, Lee, I think we're in trouble here. Obviously, Kansas has changed things because the governor can't act with emergency use or emergency mandates. That has to come from the legislature now. We explored ways to try and get people more concerned about where we are here, because I think we're in trouble. And I think we're in trouble. I said once before, like last fall, that we were on fire, and I think we're on fire again. And I think the problem is that we don't have enough people vaccinated, and then folks are not following the rules of infection prevention and control. Even if you're not vaccinated, and even if you are vaccinated, the rules are still the rules. And I was out in Johnson County doing some errands on Saturday. I saw there's nobody masking. I went to Jackson County, a little bit more masking. Went to the Royals game. I think I was one of 5 people, all in my group, who were masking out of the 40,000 or 35,000 people that are there. We're in a tough stew, and we're either going to have to make a decision to try and take those rules a little more seriously and get folks vaccinated, or we're going to pay the consequences, and I'm afraid we already are paying the consequences as the care for heart attacks and strokes and other time-sensitive diagnoses are delayed, and we continue to, and I know all of our hospitals are starting to delay surgeries across the metropolitan area. So none of us are trying to do that, but we are going to get forced to do that, and I think either because of staffing or because of census, we're all having to, recalibrate what our ORs are like right now. So
I
these are tough times.
And ask you, though, you mentioned all those patients from all those different areas. What happens to those patients? Where do they go? What ultimately happens?
You know, unfortunately, sometimes bad things happen and they don't survive, and then they keep calling until they find a place. But it may take 5 or 6 hours to locate that patient. That's all. You know, when you're infected like that and you're really sick, that's all time-sensitive stuff. You need special modalities of ventilation. You need to do prone ventilation. You need all the right therapies. You may not have those in some of the critical access hospitals. And so when people can't get transfers, they delay care. When care is delayed, that's a lot of time lost, which means there's more lung injury and death. And so it's the same thing for heart attacks and strokes or any form of infection. If you don't get the right therapy up front, then you make your odds worse as you go down. But you know, the hard part for me is I don't think we're getting enough traction out there. It doesn't feel like people are really listening. They got so much COVID fatigue that all the desire to pitch in at the beginning, people are just tired of it. But I'll tell you what, if you want to see tiredness, you want to see exhaustion, go look in the eyes of the nursing staff right now. They're in the COVID wars. That's exhaustion.
All right, so I want to bring in both of our guests today who couldn't be here at a better time. Herb Kuhn, he's the president and CEO of the Missouri Hospital Association, as well as Chad Austin, president of the Kansas Hospital Association. So both are joining us virtually this morning. Gentlemen, thank you so much for being here. I'm going to get to some questions for you, but I do want to get right to our reporter questions to get us started. Go ahead if you're on the line.
Sure. Good morning. Cody Holyoke with KMBC 9 News. And hats off to the medical staff for going through this day in and day out. I'm curious, we're seeing some local hospitals in our area, even more rural. And I know Dr. Stites says this is kind of moving out of the metro areas, starting to change up the rules for hospital visitors, visitation. Do you anticipate any major hospital changes in your footprint because of this new surge?
Yeah, that's the great question, Cody. Here's the answer, I think. So first, when we did that originally, we didn't have enough PPE. PPE is not a question, so now it is whether or not we can prevent infection spreading and control. We've discussed whether or not we should require vaccination for visitors. We have not gone that route yet, and I'm not sure that we will, but it is a question we are talking about. A second question is, do we limit visitation again? At this time, we don't believe we have spread between guests or visitors and patients. However, as this virus continues to gain in its community transmission and the amount of it that's out in the community, I think that is a really valid point. We talk about it daily. We talked about it yesterday. We had a long incident command call on a Sunday morning, and I think we may have to, but if we do, we would go from 2 to 1. I don't see us eliminating visitors altogether yet, in part because that is such an emotional toll on both the patient and the visitor, and I don't think we have a lot of trouble with infection spread or communication of disease inside the hospital, and because we have enough PPE at the moment.
And then just one follow-up question. I know it's kind of a wide net question, but I'll ask everybody who's here, what's the number one thing that people can do right now to help you guys out?
Put on a mask. Number one, put on a mask, because that bends the curve the most acutely. And then number 2, get vaccinated. I would also throw in there, we may have to start talking about distancing again, because at the moment, and dedensifying, because at the moment, if our hospitals continue to get this, if the current surge continues unabated as it is today, then we're either going to have to distance or we're just going to be overwhelmed. And I don't know which. It's a choice, and God save us, because it's a choice, and I think we have to. We do our best to take care of patients, but when we don't have enough hands and we don't have enough beds, then people are going to struggle.
Herb, what's the number one thing folks can do on the Missouri side?
The very thing that Dr. Stites said, mask up, get vaccinated. The problem with this Delta variant, with this overall pandemic, is that we know there are ways to combat it. And it's to get vaccinated, it's to social distance, it's to mask up, it's the basic mitigation things that everybody needs to do. And until we do that, we're still going to have these challenges that we're seeing every day across the state.
Chad?
Same way that, Herb mentioned and Dr. Stites mentioned, getting people to be vaccinated. Also, the proper infection prevention and control practices of hand washing, doing some social distancing when you can on the indoors, as well as being focused on wearing face masks. Those are the simple things I think that we can do as a public to be able to kind of help curtail some of the spread that we're seeing throughout the state.
Other reporter questions? Okay, so start sending in your questions from the community. Jill is standing by for those. We're going to get to those here in just a bit. Did you have something to add, Dr. Hawkinson?
Yeah, I mean, I think what we've heard on these three answers, which I fully agree with, these are simple measures that we're taking. They're simple measures. They have been proven out over these past 16, 18 months, however long it's been since COVID started. Unfortunately, we still have sometimes we're fighting with one or two hands tied behind our back because we are unable to do those things. Whether it's people who are unable or unwilling to get vaccinated, or it's the inability to have certain rules or precautions in place, such as masking, for one reason or another. So these are simple measures, simple interventions that we know work. We just need to get everybody individually doing them. Obviously, if we can't overall create either some rules or guidance for those people in whatever situation that they are in.
Okay, I want to ask all the guests this question. The question was just, what is this COVID-19 surge and how is it different than spring of 2020? But Dr. Stites, I would say, what is different than November of 2020? Can you start us out?
Yeah, you bet. So the Delta variant is just so much more transmissible. I mean, at the end of the day, this is a different disease. And what we have to realize that in the ongoing saga of the COVID wars, I'm trying to be a little bit funny, Clone Wars, COVID Wars. The COVID Wars, we're going to have different enemies from time to time, and the Delta variant is a different enemy, and it's different because it is so much more transmissible than the original or the Alpha variant. And if it is, in fact, 2 to 5 times more transmissible, which is I looked at the CDC guidance yesterday, and that's where they're landing. If that's indeed the case, which I think it is, then what happens is it takes minutes to transmit it, not 10 or 12 minutes, 2 to 4 minutes, and so it's much easier and it spreads much faster. And if you've been vaccinated, it is clear that you can still spread the variant. Now, probably much less, and your duration of illness and shedding the virus is less, but even the vaccinated can share it and can spread it. So we have to look at this like we're all in this together. So the only way to keep people out of the hospital is A, get vaccinated. We know that 95% of the patients in our hospital, 90 to 95%, are unvaccinated. Now, let's think about that, because even if we assume that 50% of our population is vaccinated, and it's not that high, but for adults it's about that, right? Because you got to take those who are under 18, and we're an adult hospital primarily. So let's say 50% are. Well, that means it's overwhelming odds that this is a disease of the unvaccinated. It can still be a disease of the vaccinated, though, so you have to take note. And the way you take note is to make sure you put on a mask and take care of yourself and take care of the people you love. But the reality is that it's much more transmissible. Even those of us who are vaccinated can still potentially transmit it. We are unlikely to be hospitalized, and we're very unlikely to die from it. 99% of our deaths are amongst the unvaccinated, but we don't even want to be in the hospital. If we all got vaccinated, if we got to 80 or 85% vaccination, our inpatient numbers would drop dramatically. We'd have 10 or 5 patients in the hospital. Okay, bring that one on, because then we can take care of everybody else in the community, which we can't right now.
What challenges are you seeing different from maybe 8-9 months ago on the Missouri side specifically?
Sure, a couple of them. One is, as Dr. Stites said, this thing comes on like a freight train. Where before it took us 5 to 6 months to get to these high levels we saw last winter, now it's taken 5 to 6 weeks. This thing moves quickly through a community, and it's very, very dangerous. The other thing that we're seeing that's so different is the fact that not only it's accelerated spread, but the spread is largely in younger people. You go through these ICU units, and unlike last winter, where you saw mostly elderly folks, now you're seeing people age 18, 20, 25, 30. Young people are in these facilities. And this has even a larger, harder strain on the hospital staff than what we saw before. Yes, it was hard last winter, and staff saw untold numbers of deaths and people that were very sick and dealing with families. But when you have someone in the prime of their life, someone who's 40 years old, who's just clinging to life in an ICU unit, it's not only hard on the family who can't understand what the heck is going on, but it's also hard on the hospital staff having to deal with seeing young men and women and even children who are passing away as a result of this variant and what's happening there. That's a game changer. And that is just adding to additional stress, burnout, and challenges in the healthcare system.
Can I just pile on really quick? Last November, our average age was 66 to 68. Right now, our average age is 52. Okay, that's average. Half of our patients are less than 52 years of age. If you think you're young and invulnerable, wrong.
You're not.
Wrong. That is not true. Children's Mercy, 22 patients with COVID-19. Come on, this is a disease of all of us now. It's not just the old and the infirm. Thank you.
Chad, your insight on this?
Yeah, back, last March, April, we were full of unknowns in terms of what needed to be happening at that point in time. And we had some initial challenges as related to personal protective equipment with N95 masks and ventilators and medical gowns and gloves. We had some challenges last summer with testing capabilities, and then just doing the public awareness and mitigation steps. And as Dr. Stites and Herb mentioned, right now it's a different ball game because we have many of those supplies. We have those capabilities of doing what we need to be doing, and it's now getting the public to really just understand the importance of getting the vaccine, as well as taking those appropriate steps with face masking and mitigation steps that need to be out there. And so I think that's probably the hardest part that we're seeing right now, as Herb alluded to, with the staff just being very much emotionally drained in terms of seeing some of the patients coming in that really have an option of getting vaccinated and taking care of what needs to be done.
Chad, I just want to ask you, though, for folks who are just joining us and who may not know exactly what your role is with the Kansas Hospital Association as far as what and how they communicate with hospitals across the state, explain to people what that role is.
Yeah, so the Kansas Hospital Association's been around for a little bit over 100 years. We're an advocacy organization that represents hospitals throughout the state of Kansas. At this point in time, we have 122 community hospitals that range from large academic medical centers to small rural critical access hospitals. And so besides some of the advocacy activities that we work on, we do provide a lot of education, networking opportunities, data sharing in terms of hospital statistics and collaboration and group purchasing. But really, this is when associations really step up in terms of pandemics and crises like this, to be able to bring people together, to be able to work together to address some of these issues across the state of Kansas.
I want to ask about supplies and staffing shortages. Herb, I'll just ask you, what do you think is driving the shortage right now with healthcare professionals?
Well, we've always had a shortage of healthcare professionals, particularly in some areas, nursing. But the pandemic has put additional stress on that, because when you get someone typically in the ICU, it might be just for a few days. These COVID patients are there 2 to 3 weeks. The stress and strain on the staff, not nurses, respiratory therapists, others. So it's a stressor there. But beyond that, we have a national market. It's no longer trying to do a regional market. This Delta variant and what we saw last winter, we're all across this country. So everybody is pushing and pulling for that same limited staff that's out there. The other thing that we're seeing a little bit too is that there are some incredibly high rates that are being paid now because it's a supply and demand issue for this staffing. A lot of those staff did very well last winter and made an awful lot of money. And what we're hearing is reports of many of them have taken the summer off and enjoying some downtime to kind of recharge and get ready and maybe get back in the marketplace in the fall. So it's a highly competitive market, and it's also a market where we have some people maybe stepping out. The other shortage we're seeing a little bit, we're starting to hear some reports in Missouri about some drugs, particularly some rheumatoid arthritis drugs that are dealt with that are under emergency use authorization, treating people that are in the ICUs. We're starting to hear shortages of some drugs for treatment of patients. That's a growing concern as well.
So does Kansas and Missouri both have a plan in place if there were ever to be a shortage, a supply shortage, bed shortage? What does that look like? Chad, I'll let you start.
Yeah, so we have been working with KDHE, the Kansas Department of Health and Environment, as well as other federal officials in terms of making sure that we have some proper channels to be put in place. And one of the things that we talked about previously was just the collaboration and working together. And one area that we're doing that is with transfers. And as Dr. Stites mentioned, that's becoming more difficult as the days go on in terms of some of the capacities that we're seeing in some of our facilities. But that's just one example where we are working with a private company that's coming through and working with about 70 to 80 of our hospitals on trying to identify when there's a need for a patient to be transferred, say, from a rural critical access hospital to a larger tertiary center, how we can do that, how quickly we can do that. And so there are collaboration efforts like that as well that we've been focused on.
Guys, one of my concerns is it doesn't feel like we're getting traction like we did last November around the seriousness and the level of this. What are your thoughts? What can we do to try and get this message better across to the public?
From my perspective, just going out and just doing the same things that we did last year with the public awareness and just putting more of a finer point in terms of what can be done by the public to be able to curtail and put under control some of the surges that we're seeing throughout the state. You mentioned, Dr. Stites, that right now at this point in time, we're seeing more of an increase in COVID cases and challenges on the eastern part of the state, in the Kansas City area, in the Wichita area, in southeast Kansas. We haven't seen the COVID surges as much out in the western part of the state, but that's one thing that we're preparing with those communities to talk with them about what can they be doing at this point in time to hopefully prevent, this gradual movement of COVID throughout the state of Kansas.
Let me just share a thought about Missouri, what we're doing with this, with these shortages and what we're seeing. In Missouri, we had kind of a red letter day last week on August 11th when we surpassed our highest peak last winter in terms of COVID ICU patients. Think about that for a minute. We had a huge peak last winter, but last week we surpassed that. So when we talk about a strained system and a shortage is out there, it's real and it's here, folks, when you're at those levels. So we've got a number of things going on in Missouri to begin helping address that. One, our governor authorized here a few weeks ago with EMS Strike Teams. We've got 30 of them, new strike teams in the state to help transfer patients and move them about. Dr. Stites talked about that at the beginning of the program, and we're seeing those kind of massive movements to different states of patients just to find a bed for those folks to be. Doing some things to decompress the hospitals where we can, and working to set up some monoclonal antibody infusion centers across the state to help us kind of decompress the hospitals that we're seeing there. And then fortunately, at least from the winter forward, the state of Missouri does have a pretty good supply of ventilators. But we've already tapped into that supply for 75 ventilators across the state already because of this surge that we're seeing. So we're putting in place the pieces to deal with this growing surge, but it's tough.
It is tough. And I just, at what point do you all think we have to put distancing or de-densifying back on the table? Are we there? Is there even any political appetite when you have to talk to legislators and political leaders for that? Herb, what do you think about
Boy, there's little appetite for that. I mean, you kind of go, it's almost retail right now. You've got to go person to person and have these conversations, these massive movements, whether it's mandatory masking, some other activities are really tough. But I do think we will see a change pretty soon. Hopefully we'll see FDA give final approval to the vaccines, move them from emergency use authorization to final approval. I think when that happens, you'll see more businesses, more schools, more hospitals, other nursing homes, others begin to move to mandatory vaccination. I think that will help.
I think you're right. What do you think, Chad? Any thought about more of a mask mandate for the state or de-densifying or distancing, et cetera?
I think, as Herb pointed out, a statewide mask mandate would be difficult, I think, at this point in time from a legislative perspective. But I do think there are some game changers that could happen, and Herb articulated one of them, which is, getting the full authorization of the vaccine. And I think once that does happen, we will see more people comfortable in terms of moving forward, whether requiring the vaccine, which we believe, every employer should have the ability to be able to do that, but also being able to get more confidence from the public with the vaccine. And so, one of the messages that we've been carrying out with the general public is if you're uncertain about whether or not you should get the vaccine, go talk with your local primary care provider. Talk with them about, what the opportunities would be, what the risks are, and be able to work with them to be able to get some guidance.
Yeah, my big fear in the vaccination, Jess, and team is just that, the first vaccine dose, if you have the messenger RNA, well, that's a domino, right, in the United States, and then you really don't have the protection against the Delta variant. So you have to wait really 4 to 6 weeks. With the original strain, man, within a few weeks, you get some pretty good protection even with one shot. That is not true of the Delta variant, so it's going to be at least 6 weeks after your first dose before you say, hey, I've really got some protection going. And so, Hawkeye, I just think that's a critical time period. We're at a difficult juncture, and my fear fear is what's going to happen is the hospitals are going to continue to get overwhelmed, and it's going to affect everybody, not just the unvaccinated, right? Because the surgeries we delay now are going to be things like cancer surgeries, heart surgeries, things where there's risk in delaying because you don't have enough beds. And I don't know at what point traction really happens. I understand that this is difficult. We all have COVID weariness syndrome or cows, but we're struggling to make sure we do the right thing for our patients and our community and how best to do that. So I don't know, Hawk, any thoughts that you have on what to do?
No, I mean, I think that's exactly right. I think you talked about early on the immediate effects versus the longer term effects, and certainly we know vaccination protection will take a while, so there are those other things that we can do and try to do that so that we can continue to do the things that we like to do, want to be out at gatherings, things like Arrowhead or the K. But also we know that it will be winter soon, so unfortunately we are going to have to be moving inside and doing those things. So we need to get started on those long-term things like continuing to promote vaccination, but also those immediate things like masking.
I went to my first baseball game on Saturday night in 2 years. They go, why'd you go that night? I'm like, I'm just going to wear a mask. I've been vaccinated. I think I can be safe. It's outside.
Yeah.
But the crowd, there's a big crowd. So you walk on the inside concourse, you walk around and think, is that inside or outside? I kept my mask on the whole time, right? I kept my mask on during the game. And I don't know what's right all the time on stuff like that, but here's what I do know is right. It is not right to make other people sick. That's bad.
Yeah.
So how do you make sure you're not making people sick? You got to show your love. How do you show your love? Put your mask on.
Love that. We've been talking about staffing. I interviewed a couple of frontline staff workers, and it's like interviewing them a year ago. So it's very interesting. Dr. Hawkins, I'm curious, what are you seeing with your colleagues and those folks that are working up on those units? Mm-hmm. What are they saying? How are they doing?
Yeah, I mean, with the infectious disease physicians, with the critical care pulmonary, the hospitalists especially taking care of really all of these patients, it gets tough. And, the treatments really haven't changed. We are still doing everything we can, again, with remdesivir, with blood thinners, with steroids, one or two other drugs if you are that ill and you meet that criteria. But unfortunately, a lot of these, or fortunately, a lot of these things are preventable. And the biggest way to prevention of doing this is to continually get the vaccine. Again, the majority of the patients we are seeing here continue to be unvaccinated. And that, that does take its toll and chips away even at the most ardent healthcare professionals, because we know we could have protected you from coming in if you would have gotten vaccinated.
And I think our nursing staff is tough, right? Those guys, those folks, they're working really hard.
12 hours a day.
They are working a lot of hours, and then we ask them to do extra shifts because we don't have enough staff. And to Herb and Chad's point, the healthcare workers have left the profession, or they've done other things, and so it's just, these are hard times. I've been a physician for 35 years, and if in case somebody asks you this question, that's a long time. Is that a long time? 35 years, that's a long time. And sort of got through the HIV crisis in the late 80s and early 90s. I've said to this audience before, that was a really hard time. But I think this one's a little harder. There's a lot of political fighting about AIDS, too. Those of us those younger folks don't remember how bad it was, and that it was a rancid time then as well. But gosh, this virus is so darn transmissible. And we have an answer, and people aren't accepting the answer, and so as a result, we're all just getting sick, and we're delaying care, and we can't take care of people, and the nursing staff is burned out.
People were so scared of AIDS, you almost wish people were as scared of COVID as they were.
Wouldn't that be better? Yeah, people wore condoms, but and HIV was very transmissible if you didn't have barrier protection, and it was a political hotcake back then, and just as this is as well. But at the end of the day, I think we just have to step back and say, what is the right thing to do? Because as much as we've been a little doom and gloom this morning, the answer on what to do hasn't changed. And nor has the success of it really changed. Because vaccination still works to prevent serious hospitalization and deaths. We have the tool, right? We have the tool, and everybody as an individual has the rest of the tools. You can do the same things we told you before, that the rules of infection control, they still protect you, they still take care of you wherever you go. You just got to follow the rules. When you choose not to follow the rules, then people get sick. And I tell you, there are a lot of patients who die up here from COVID-19, as there are across the country. I've not heard anyone say, darn it, I wish I hadn't gotten vaccinated. Darn it, I wish I hadn't worn a mask. Most people are saying, gosh, I didn't realize COVID was so bad. I don't know how you miss it.
On that note, let's get to some community questions. Jill, I know you got some good ones coming in on this Monday. Good morning to you.
Good morning. They are flooding in. The first question is going to be from Tracy, who says, I remember when you had 120 patients and you said you were full. So how can you be full with just 80?
Yeah, you bet. So the reason we're not at a much higher level on COVID patients is our transfer center we're denying so many patients. We usually take 2/3 of the transfer center patients, and we may get 3,000 or 4,000 requests a month. And right now, I don't know, but maybe 20% or so of those are COVID requests. And that may not be accurate, but let's run with that number for me for just a minute. Well, our transfer requests are tripled, and the difference is we've gone from a 65% acceptance rate down to about 10 or 15%. And so we're just not taking in the same number of patients, and we're not taking the same number of COVID patients because we don't have any beds. And as a result, our numbers would be much higher. I think we would have well exceeded our peak COVID census had we had our transfer center more open. Second thing is, why are we so full? During the period when everybody had shut down, all disease entities sort of decreased. All those infection-related problems, the RSV patients, the influenza patients, they all sort of went away. And what was interesting is we didn't see the same number of COPD exacerbations or asthma or emphysema or GI bleed. And I think it was all infection-related. That when you're not out there and you're not exchanging rhinovirus or more simple viruses, which can take a patient who is chronically ill with their lung disease and tip them over and bring them into the hospital. Well, they weren't coming in. So we had that going on. And then the other thing is people were avoiding care. We had heart attacks and strokes and cancer patients not coming in. It's well documented that when people were having heart attacks during the height of the pandemic, the heart attacks were worse. And now what's happening is people are trying to come in, they're trying to get their cancer surgeries, et cetera. But the problem is that the hospitals are really full. So I think what we are seeing is we have a really high census. In part, it's still a rebound from people not seeking care before, in part because there's a lot of viral transmission of all sorts of diseases out in the communities nobody's masked, and in part because we have a lot of COVID patients sitting in beds. Those things have pushed our weekend census this weekend. Our weekend census on Saturday was 800. Our normal weekend census is about 650 or 680. We're having 100 patients more, 120 people more. That's a lot. So that's why we are so full. People are sick. They're weary and they're sick. So I don't know, Chad and Herb, is that what you're seeing throughout Missouri? Are all your hospitals full too?
Yeah, people are just full with COVID, and for the very reason you say, they suspended so much of the elective procedures and other procedures last year, early this year, and they're getting caught up on those. And sadly, many of those folks that are coming in are even more ill than they would have been had they sought care earlier. So it's even putting more strain on the system. The other thing too is folks have to understand that in Kansas City, in the emergency departments there, they have been on forced open on several occasions over the last couple weeks. And what I mean by forced open, the fact is that when an emergency department in one of the hospitals is overwhelmed, they go on diversion and the others pick up the slack. Everybody is getting slammed out there. And so they've had to kind of create, as part of their model, this forced open where everybody just has to take folks or be open to be there. That causes extreme backups, creates some real challenges in those departments. So everybody's really seeing this surge from all these different angles and all these different activities that are going on out there right now.
And what happens then, just to follow up on that, Herb, that's a great point, that forced open thing. What it means is you have to accept the ambulance into your ambulance bay. It doesn't mean that the patient, once they get here, gets care very quickly. So there's the stretcher time, the time between the time the ambulance arrives and the patient actually starts getting care, when the EMS team is sitting in the hallway attending to the patient on the gurney, and that number has quadrupled. And the reason it's gone up so much is because everybody's full. And you can track that statistic on the EMS dashboard here in the city. So, it's difficult right now, and it's difficult because we're all full.
Dr. Stites, I'm glad you raised that, because you're right. It's causing backup. But what it's creating for all the hospitals, kind of this load balancing, where everybody's trying to shoulder their part of the load. But when everybody's full, it makes it even more difficult to happen.
Yep.
All right, so
just to be able to
Chad.
Yeah. Yeah, just to share from a statewide perspective in Kansas, as we mentioned previously, we've seen some significant increases in COVID cases in the Kansas City area and southeast Kansas, as well as in the Wichita south central part of the state as well. But as we've been talking about throughout this morning, just because your community may not be seeing as much if you're out in western Kansas as much with COVID cases, you're still having an impact because there are still healthcare needs that are needed out in those rural parts of the state in western Kansas. And if you can't find the space to be able to go get that treatment for those acute care services at a larger referral center, then that's where you're also having the indirect effect as well. And so really everyone's being impacted by the recent surge, regardless if it's COVID or other medical needs that are needed within those communities.
Chad, this question is for you, and it comes from Sally. She wants to know, what is the Kansas Hospital Association advocating at a legislative level to try to help Kansas get better manage the COVID crisis?
So we're meeting with our legislative leadership in the governor's office in terms of allocating with funding to be able to help ensure that we have proper equipment, proper supplies that are out there. Also working with our legislative leaders in the governor's office, making sure that we have the appropriate drugs to be able to come in. We talked about remdesivir or other types of drugs that will help us treat patients throughout the state of Kansas. In addition, looking for workforce related issues, looking at what can we do as a state to ensure that we are able to staff our hospitals appropriately. And Herb mentioned previously that we've been facing a workforce crisis on the areas of nursing, but now we're seeing it with all levels of staffing, whether it's all the way down to housekeeping, all the way up to lab techs, nursing, physicians. And so working with the state to see what we can do to be able to recruit more individuals within the state of Kansas to serve the needs of Kansans.
Jean and Shirley say that it's really confusing information around the boosters that just made the news recently, and they both are pointing to Hy-Vee that is offering booster shots now, and they say, is it on the honor system? Because all they're asking is, have you had your first or second dose?
Yeah, I mean, at that point, if they are doing it that way, they certainly would be on the honor system. Again, the CDC guidance right now is there's no need for additional dosing or booster, if you will, if you are otherwise immunocompromised. If you are immunocompromised, you more than likely know that you are. You are being managed by a medical team, a physician group, for either those immunosuppressive drugs or that immunosuppressive condition. So from the example that was given, yeah, that would be on the honor system. And again, there are very specific criteria for being considered immunosuppressed or immunocompromised for needing that additional dosing. Otherwise, it would be on the honor system as far as just anybody being able to walk in, unfortunately.
So is Hy-Vee just able to do that? I thought you had to go through your doctor. Do we know?
Well, no, you don't. You can get a third shot now that it's been, the early EUA has been extended like that. And KDHE actually put out a really nice bulletin last Friday about who's eligible for it, and you can Google it and get it, or we can try and bring it in tomorrow. They did a really nice job outlining who is eligible for it. But it's just like going to get the shot, the first shot. You can go get it right now, right?
Yeah.
You haven't been vaccinated, you walk into a pharmacy and get it. You can get the third shot too.
But if you don't really need it for some sort of underlying issue, could it be not a good thing?
You know, what we have seen with the studies looking at those immunosuppressed populations who have gotten those additional dosing, and again, a lot of these studies are from those trials that have been able to get the data, analyze it, and that is why it is recommended for certain immunosuppressed populations to get additional dosing. But what they saw is it continues to be very safe. Again, I think it's one more point, especially if you're vaccine hesitant and worried about safety. There are people now who are clamoring to get a third dose or additional dosing because they know it's safe. So safety continues to not be a factor here. We know that these vaccines are safe. So if you haven't gotten any vaccination, please go get vaccination, whether it's with the mRNA vaccines or the adenovirus vector vaccines.
And just to say, I think what people are doing is they're jumping the gun a little bit, right? Because the Biden administration is becoming pretty clear they're going to start talking about booster shots for the entire population. And it's probably going to go to nursing home worker or nursing homes first, healthcare workers second, and then over 65, and then the general population, which is really how we rolled out the vaccinations to start with. And so if that's the case, I think people are hearing that, and they're just going to, it's funny. We got folks who can't wait to get the third dose, and then we got people who won't come close to getting a vaccine. So it's just an interesting dichotomy we're faced with. But there are clearly people who are out there jumping the gun.
Okay, Kat wants to know, is there any truth that vaccinated people can spread the Delta variant?
It looks like they can, not I think, Hawk, to the degree that those who are unvaccinated, and for a much shorter window. I think that data came out yesterday that looks like the people who are vaccinated, if they do spread, they're less likely to spread, and it is a much shorter window than if you've been unvaccinated.
Yeah, I mean, certainly from a couple earlier seminal papers, especially what we've heard from the MMWR, where they looked at the Massachusetts town where there was large spread of disease. A majority of those people tried to do things in their responsible and thoughtful manner and were vaccinated. But unfortunately, they did see a lot of cases spread from there. Now, the good thing from that is, as well, as there were very few cases that had to go to the hospital.
I don't think they had a hospitalization in Providence, did they? If they had one or two out of 1,000 people. Yeah, it's a very small number.
So, but there is data looking at vaccinated who can spread the disease, and so it's done by that.
Okay, I know that we have a lot of questions, but I also know that our guests have some hard outs today because of meetings and obligations. So we're going to take a couple of more. All of you people that have questions about immunosuppressed and if you're on Humira and all of that, bring those tomorrow for our guests. Jess will tell you more about that in just a moment. A couple of final questions. Lindsay wants to know, how do I care for myself at home if I've got COVID?
How do I do what?
Care for
myself and my family. How do I treat my symptoms? How do I keep my family safe?
Yeah, I mean, I think first of all, if you start having symptoms or you're diagnosed, again, trying to isolate yourself away from the rest of the household is going to be very important. We understand that certain households that's going to be difficult just due to square footage and not enough room, but that will be the first step. The second, if you're treating yourself, again, there are no outpatient therapies other than the monoclonal antibodies if you meet the criteria to get those. But if you're just treating yourself at home, it continues to be those same things. Hydration, nutrition, rest. Certainly you can take Tylenol or ibuprofen if you need it, and it's going to be those simple at-home remedies to really deal with your symptoms.
All right, and Sarah wants to know, her daughter's 9, she takes steroids for asthma. Does that offer any added protection if you take
probably
steroids?
Probably not. And in fact, I would say that asthma, originally not thought to be a risk factor for more difficult outcomes with COVID-19, that has since now been made the list of those places where you are more at risk. So I would say not. Now, the question really, I think, is somebody saying, well, gosh, Decadron is used to treat COVID-19 in the hospital. That's true. It is effective, also true. Does prednisone help prevent it? No. Actually, high-dose steroids are considered one of those cases that, A, you may not get as good a vaccine response if you've been vaccinated. B, you may be a little more susceptible to some of the initial injury from the lung, even though we may then give you steroids later in the course of the disease. So I know that's a little odd, but it really just has to do with your ability to respond to the initial infection.
We know that steroids, when given at the wrong time, i.e. early on in that disease, can actually portend a worse outcome. So we know that some people or some practitioners were giving steroids for people who had come into either an urgent care or a doctor's office. We're getting steroids probably at that wrong time. You're still in that viral stage early on in that disease, and that's when your body is fighting off the virus. So you need all of your immune cells. The prednisone will help reduce those immune system cells. So again, just as Dr. Stites had said, we do give Decadron, and that's steroid, but it is at a certain time point when you meet that criteria.
Okay, so many great questions. You guys just are so thoughtful, and you have great ideas too. We will continue to ask those questions. Vicki gets the last one today. She wants to know, does testing show love for our fellow men and women too? She says that, is it important? A lot of people don't want to get tested because they don't want to interrupt their lives.
Wow, that's a great comment. Absolutely, it does show love because it shows you care about not giving it to somebody else and not trying to hide under a rock around that and potentially making somebody really sick. So absolutely it does, and you've raised a great point because people are doing a lot of at-home testing now. So when we see our testing numbers go up, it's really the tip of the iceberg because we believe that A, a lot of people aren't getting tested, and B, a lot of people are testing at home and then keeping the results private. So I think that that's a great point, and I appreciate that. Thank you.
Yeah, I would absolutely agree. It certainly is. It's one more action you can do. We know that other respiratory viruses are going around now as well, so you may have one of those. So I think it's best to get tested. If not, then really you should be isolating at home for at least 10 days from when you started to have symptoms. So the better option, I think, would be to testing, because then if it is negative, especially with the highly sensitive PCR tests, then you know you can kind of get back to your routine.
You know, Hawkeye, I like that. Best to test.
Yeah,
That's good.
That's
Best
right.
to test.
All right, thanks so much to our guests today. Herb and Chad, thank you so much. Just want to get your final thoughts just as we head out today, and also just your thoughts on showing the love through testing as well. Herb, I'll start with you.
You bet. So almost a month ago to the day, I remember it was July 15th, Dr. Francis Collins, the head of the NIH, said Missouri was the place he was most worried about. And as I mentioned earlier, I think there was good reason to issue that alarm. The fact that last week we surpassed our ICU levels over last winter's is a remarkable milestone, and a very sad milestone, but it tells you how serious and how problematic this Delta variant is. And the important things for people in the bi-state area need to realize is that we still have not peaked in Kansas City or St. Louis. So the final thoughts would be the Delta variant, as we've talked about today, is much more transmissible. And people are sicker and they're younger. We also know because of the Delta variant, we have a lot of people that are not adhering very well to mitigation strategies, masking, social distancing, and of course, we know vaccination is the route out of this. Vaccinations are picking up in Missouri, but not fast enough. So we have to do the other things that need to be done, such as masking, to move forward. And then finally, in terms of final thoughts, I just want to give once again a big shout out and a thank you to all the physicians, the nurses, all the other hospital staff, all the healthcare leaders out there in the bi-state area that are working very closely together. As I mentioned earlier, there's a lot of load balancing going on in Kansas City, which is remarkable and very helpful to make sure people in Kansas City are safe and treated and taken care as well as they can. The leaders in Kansas City are working very well together, and I think it will help us make a difference in that area.
Herb, so appreciative of you being with us today. Thank you. Chad, your final thoughts today? What do you want us to know?
Well, pretty much ditto what Herb said, and indicating that, thank you very much for all of our healthcare leaders throughout the state of Kansas, as well as the Kansas City area, in terms of all the tireless care that you're providing to your community members. We're going to get through this together, but it's going to take a team effort to be able to do that. And as Herb mentioned, and Dr. Stites mentioned, everyone else, we're going to have to take control of the mitigation steps, whether that's face masking, whether that's getting the vaccine, whether that's social distancing, when appropriate, getting everyone to really take this seriously so that we can get this under control. Because as we've talked about today, we still have not peaked from at least the data that we're seeing in terms of where we're going with the COVID vaccine or COVID pandemic.
Chad, thank you so much for being with us. Dr. Hawkinson, your final thoughts today.
Yeah, I think I echo all of these statements and everything that was brought up before. We are going to be getting into cooler weather now. We are going to still want to be able to gather and get together and do things that we would normally do in these cooler weather, whether it's going to events, being with friends or family. So right now, the best way that we can start is by getting vaccinated now. Continue to talk to your friends and the people that you know to get vaccinated. Immediately, as Dr. Stites had said, the other things we can do is start to mask. And that especially includes schools now. We know that the way to protect children in schools is by distancing as much as you can, given the restrictions in any particular building, but also good air ventilation, masking, and then, of course, everybody who is eligible for vaccination in that particular area, please get vaccinated. That is the way that we can continue to help protect each other, the young people, and also keep the young people in school, because we know that is so important when they can be together and socialize rather than being home isolated in that virtual learning.
Dr. Stites, head us out into the week. What do you have for us?
Oh, here's what I would say. I really love having Herb and Chad on here. So first of all, thanks to these guys for being on. That's a really big deal. You heard our voice today. You're going to be hearing it. We're trying to organize these regional calls on our for metro calls on a weekly basis with both these good folks and with our Mark folks and others and some political leaders. So, I think what we want you to realize is that, especially in those communities that have not been hit yet, heed not safety in an absence of COVID, because it is coming to you. Just as in the fall, when COVID came to the cities and then progressed into the outstate areas, it is coming to all of us and to all of the United States. Yes, Springfield was perhaps the epicenter of the Delta wave that has been spreading throughout the country. And to Francis Collins' point last middle of July when he did say, I fear that Missouri is in trouble. As it creeps around our area, we know what to do. And what I would ask is, if you can't wear a mask, if you don't want to wear a mask, you don't want to get vaccinated, just think about the healthcare workers you're going to need if you have a heart attack or stroke or a GI bleed or anything else. You're going to need them. You're going to need those folks here. And how do you guarantee that we're all here? You have to show the love, right? You got to show the love. And there's only one good way to do that right now, which is you got to put a mask on and you got to get vaccinated. If you can do those things, you'll help keep us all safe from whatever disease you may have. Remember that, right? From whatever disease. It's not just about COVID. It's really about all of the things that take us to a hospital where we expect to be treated with great care and great love and with great hands and great teams. But if those teams are overwhelmed, it's hard for us to show the love. We need you all to show the love to us so we can show the love back to you.
Thank you, Dr. Stites. Appreciate it. Okay, and thank you all for being here today. Tomorrow, we're going to hear from one of our immunocompromised patients with what this third booster shot will mean to him and ultimately his quality of life. Also, his message to those still waiting to get that vaccine. Plus, Dr. Joe McGurk is back to talk about who might qualify for that third shot and how they can get it. Jill had mentioned he works with immunocompromised patients, so he can answer all of those great questions that you had today about that. So join us for that tomorrow. We will see you back here at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.